Good evening, viewers. Hope you all are doing truly well and are also trying to stay as safe as possible as we are going ahead, progressing well while we are unlocking and getting into this new normal. We are, of course, back. It's Friday, so it is time for our bone muscle joint series, and we are back with Dr. Aashish Arbat with us today. Uh, Before we get into the session, let me quickly give you an introduction. Uh, as a lot of you know, and for the ones who are new, True Wealth online health channel is basically a True Wealth integrative healthcare initiative which provides integrative and personalized health and nutrition advice to guide patients and healthy individuals to overcome their health concerns and manage self-health to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. A quick note, the True Wealth Live programs are organized for education and spreading more awareness to reach the ultimate goal of health and happiness. The knowledge and experiences shared by the speakers and other participants just cannot be treated as a consultation or a personalized consultation. Every individual we believe is different and hence needs an integrated, personalized consultation to prevent or cure ailments. So for the same, you can reach us and we will be happy to connect you with Dr. Aashish Arbat as well. You can reach us on 98200483669 or visit our website www.truewealth.in. You can also put in your questions on that number or in the comment box of the different channels where we are actually relaying the program today. So feel free to put your comments and questions in, and we will try to do more than justice, I'm sure, to your questions and concerns. Also, just keep a note that we will not be actually giving any COVID-19 related treatment advice on this program. Um, Having said that, I would like to introduce to you the bone muscle joint series. This series is has been launched basically to give all of you more understanding, of course, about bone muscle joint health and the different issues that we all face through our life. About with muscles, bones, and joints, especially the elder ones have a lot of them. Having said that, we want to educate you with all the details, let you know about the newer techniques that are there in surgeries today, and you will realize how much surgeries are more safer, easier to recover, and not to be really worried about. We thought that this time, downtime, is a good time for you to know about it, and we will also be helping you to understand which type of implants to choose, what type of surgeons actually treat these issues, and which is the best hospital, how to choose where to go. These are all the approaches this series actually has is going to help you with. We also, of course, will be talking about the role of nutrition and diet and integrative management. When you go through surgeries, or even if it's a preventive approach, all of that. Having said that, I just don't want to waste even a single minute in introducing uh, our guest and celebrity who's always relentlessly with us, preparing for the bone muscle joint series and talking to us on various different conditions and the different types of surgeries involved in the same, the different techniques, the latest techniques. Dr. Aashish Arbat, of course, he's one of the first 3D robotic joint replacement surgeons in Western India. He's a consultant orthopedic surgeon at the Jehangir Hospital and the Sahyadri Hospital, Pune. He also practices at the Cure Hospital, Aditi Hospital, Ruby Clinic in Mumbai, Thane, and Kalyan regions. He has an MS Orthopaedics degree from the coveted KEM Hospital. He also has a MCH in Ortho from the Royal College of Surgeons, UK. So and he doesn't stop there. He's globetrotted. He's of course learned his skills across, and has also been a faculty for the UKMCH author course, and he has a fellowship from the Princeton University, New Jersey, under Dr. Jeff Abrams, and he's first Indian fellow under Dr. Ed Sugaya in shoulder and elbow arthroscopy. These are the two faculties who are very well renowned in the world, and he's worked with them. He's been the first fellow with them is so much amazing an achievement. He also has a Pune Sports Medicine Fellowship from Japan. He's associated with the IPL Gujarat Pro Kabaddi League, India, and Pune Wrestling Federation, and he has been a part of devising the patient information system with the government of Scotland. He doesn't stop there. He is actually relentlessly working with the different type of implants, 3D robotics, all the newer techniques that coming up. He's not only getting skilled in that, but also teaching the same, and also a part of designing and devising the same thing. So we're very happy to have Dr. Aashish Arbat here with us. Dr. Arbat, it's always a pleasure to be able to run this very important bone muscle joint series with you. People have gone through a horrendous time in the last whole year. It's been like, lockdown, unlock, everything. But the pain, the bone muscle joint issues, they don't go away. They're good. They're bothering so many of us at home. In fact, a lot of conditions have been aggravated. The older people in the house are uncomfortable, but your team, we know, is relentlessly available and is trying to make things safe for the patients to be able to even go through meeting you and or doing an online consultation, and if need be, also going through a surgery. You've been very kind and actually, coming and sharing all these inputs with us, so that the patients out there can actually make a right decision when they are actually facing any of these bone muscle joint issues. We are very happy that today it's again going to be your main forte. Actually, you are actually adept at a lot many surgeries, but today's topic is going to be on knee replacement and the partial knee replacement, understanding it better. I would like you to say a few words before we would begin with the program.
Hi, Rajshri, and it's been a great privilege to be with this Beauty, Brains, Bravery forum, and we've always been very happy to share to this part of the world what is going on new, the latest. So we've covered robotics, we have covered natural anatomical knee replacement, we have covered the various type of ligament reconstructions with internal bracing all inside and these kind of techniques, and how we are now geared up with this new normal, and how we are doing now. The cases have started, people are coming out, and they need not worry about this present COVID situation and stuff like that. So today we are going to talk about the latest in minimally invasive surgery, that is joint replacement with robotics and unicompartmental partial anatomical knee replacement, where the idea is to save all your ligaments, have minimal stitches and early recovery, going back to work, and having minimal implant in the body. So that is unicompartmental, or UKR, or partial knee replacement, with some evidence-based paper sharing what is going on in the world and why the world is moving towards uh, unicompartmental knee replacement than the total knee replacement, and how can you prevent total knee replacement if you undergo this procedure early.
So we would really want to shoot a lot of questions at you. First day, of course, you're very good at actually explaining things very easily to the viewers. So we would first of all really like to understand, when are these kind of replacements needed, and how a partial knee replacement is better than, of course, a total. And how do you decide, and how do viewers really understand what this partial knee replacement is? Of course, we do it early, and we do it. It's going to protect your natural knee, but we would like to hear more about that from you.
Rajesh, I would like to share a study and our PPT on that. Hope it is seen.
Yes.
So, so this is us. And why do you need a knee replacement? First of all, like every time I share this, uh, this is your basic knee structure, and this is what we lose. This is a cartilage. And when you talk about osteoarthritis, this is the white structure that we lose over the years. This is how we walk, and this is our structure of the knee. And whenever they talk about osteoarthritis or any kind of arthritis, the basic is that this cartilage gets lost, and then it goes from mild to moderate to severe. And see this patches of cartilage that is lost. There are multiple reasons that we have discussed in previous lectures, ranging from age to genetics to some metabolic diseases to rheumatism and all other stuff. But this is what happens, and ultimately your knee looks something like this, and then you have severe pain, and these all degenerative issues. And we are tackling with this loss of cartilage with some newer implants. So Rajesh, these are the conditions where we advise uh, unicondylar or a total knee replacement. And when you go to a doctor, he advises a TKR, and the viewer should know that what is new and how can you prevent something uh, called as a total knee replacement and the complications related to it. So this is how you come down with the x-rays. Many people, most of the people, around 70% people, Rajashri, have this medial compartment. There are three compartments, one, two, and the patellar compartment here. Most of the people come down with the medial osteoarthritis, and in there we end up, most of the conventional TKR patients end up in a total knee replacement. But what is latest offering is the unicondylar knee replacement that we are going to talk about today.
Yeah, so that's really something which is we want more information, of course, to understand. So how does this really actually help in preventing our natural knee? Because would you explain that better, and what should the patients be really doing so that they can actually save the natural knee portion and have their own knee intact, so that even though they are going through a partial replacement, it's going to be more, of course, they're going to be able to preserve it more. It's going to be more long term, and it's also going to help them better in their mobility.
Yes, Rajesh, I'll just share some latest study paper from the US, that what exactly is this partial knee replacement. So now if you can see this, I hope you can see the paper.
Yes.
So this is what we were talking about, is this kind of x-rays where you get only the medial compartment and other compartments are okay. Around 60% of the world population suffer from this. So either they are asked to bear the pain till the whole knee gets bad, that is near about 10 to 15 years of painkillers and any other therapies, or what we do now, instead of touching or doing anything to the other part of the knees, we just do something like this. So can you see this? Just replace the
Yeah.
partial part of the knee. I think you can appreciate the. So this is what we do.
Mm-hmm.
and medial. So what is the statistics about it is most of the countries in the world, Spain, Japan, Korea, United Nations, and United Kingdom, the there is around 98% survival for the first 10 to 20 years. So if this is the condition, why do we go for the conventional TKR where the survival is only 7%? So if you come, many of these patients who are having only medial compartment osteoarthritis, we can go for this. The revision rate is also very less. Complications, if you can see, in 10 years are the least compared to other TKRs, where the complication rate for the total knee replacement, which the conventional doctors do, see these rates, Rajashri. It is just 3%. Here it is 11%. So 11% is for the regular. So out of 10, 11 people might have some complications, but here only
Right.
one person can go. And so it is a very safe surgery. The cumulative probability of the first revision in 10 years for UKR is nothing as compared to the regular TKR. The indications are now symptomatic anterior-medial osteoarthritis. That is the central part or the medial part of the knee when it is has osteoarthritis. We can do what is known as this unicondylar knee replacement, and what I will be talking about, what we do here and how robotics and other stuff can actually make us achieve that goal.
Right. So, are you as a, you've been practicing knee replacements now for almost more than a decade, almost 2 decades. What have you seen? I mean, do you see that there's a lot of surge in the knee issues, and also the number of surgeries that are done? Also, is it now that the younger population is actually experiencing more of these issues?
So Rajeshri, this is a rhetorical question which keep on asking: is cancer increased? Is the are the cardiac thing increased? I think the consciousness of people have increased. People have come to know
Yeah,
about the
right.
disease because we are. Google has helped a lot in learning these issues. The patients approaching for these kind of pains has increased because initially what used to happen is there were no services. So it is imperative, they were always there. The first osteoarthritis found, if you search on YouTube, was around mummies which were around 10 million years old. So osteoarthritis is a genetic problem which is there since millions of years. I'm adding that million word. It is a very very
Mm-hmm.
old disease. It is since the Homo sapiens have started standing erect, and it is not a recent disease. So it is not a new disease. We are just having some means of curing it, and we are going every year, every month, every decade with new things. When they started doing joint replacements, when they just started doing the conventional that we talked, then the anatomical came. With anatomical, the whole idea was to save the ligaments. And with the partial, like if you can share what
Mm-hmm.
we do, uh, like if this kind of patient come, you can see this.
Yeah.
What we do is, instead of going for this total knee, we can use a small cap on the medial side, म्हणजे मधली side, and save all the ligaments, not touch any of the bones, not do any cutting. It is just scraping with robotics, and place a small cap. And the way you saw that x-rays, something like this. It is a gold or a silver cap, and this is how the x-rays are seen. And this is a on table movement in the robo
Okay.
with hardly 3 stitches. And so it's a stitchless and a painless surgery. How we do it? What we do is, we plan everything. I mean, in our 3D robo with a CT scan is the first 3D robo I will be talking about. Uh, and this software we plan to the depth of 99% of the patient's anatomy. We
Mm-hmm.
plan everything. What are the deformities? What are the angles? in near about 48 points in 3 dimensions, which none of the uh, natural human eyes can do. And after that, we place something, what I showed you is like the partial knee. And in the painless anesthesia part, what last time also we discussed, that we have only blocks under sonography. So the patient is totally conscious during the procedure. It's a very, very straightforward, simple procedure. And for the first hour of the surgery, look at this. It's around 20 to 25 minutes to 30 minutes procedure, which involving only the skin and the subcutaneous tissue. And you can see some results that we'll be sharing uh, after this.
Sure. So what we really learned from what you've shown us, that this type of a partial knee replacement, especially this specific technique you're following, actually helps us really preserve the knee, the range of motion, its function, and also it helps us preserve the healthy tissue and the tissue and the bone in the knee, really. That's really something which is good, and which of course viewers should know about. Also, the fact is that these, they could be a candidate for total knee replacement, but an initial one, when they do a partial one, they can preserve so many things. Having said that, of course, it must be minimizing the risk of an infection as well, isn't it, Dr. Arbut?
Yes, yes, because now if we can, I can share the screen here. Now you can see in the conventional TKR, can you see this?
Yes.
This is a stage 4 that people come in, and when they have 3 compartmental, we advise them, like last time we said, a total knee replacement. But we nowadays don't do the total knee, we do something anatomical. And these were the bad results of the total knee replacement, which have been added, where conventional TKR can get loose, but when it is placed in the patient's angle with robotics and the latest stuff, the failure rates are very less. Now coming to this part, we are talking about infection, patient compliance. Here is the incision, this small blue, sky blue is our incision, Rajashree. It's just 3 fingers. Whereas in the conventional TKR, this is the big incision. This is our incision where we cut only the fascia. So none of this muscles and ligaments, bones, nothing are damaged. And then we place this partial cap, which is uncemented, unlike the regular TKR. And then it is placed with painless anesthesia and something like this, and see the results, Rajeshri, post-operative. So this is a partial knee replacement patients with a minimal scar, and they can do all the natural activities. And I'll be showing maximum results of a unicondylar knee replacement, where patients can really go back to their activities like
Mm-hmm.
yoga and
Okay.
other stuff. And add to that, we are now also uh, making patients walk within the first day of surgery and stand within the first 4 hours of surgery. This because there are no stitches, there are hardly any tissues cut inside. So it's like coming for a cataract surgery and going home. Secondly, we are not taking any stitches on the skin. There are special glues,
Yeah.
something called as the dermabrand pranio and all that. That helps, that the patient has not to come for any stitch removal or any stuff like that post surgery. And that's what we can offer, which we call it as a painless and stitchless surgery with a partial knee replacement. And if I can, I'll share some patient videos
Yeah.
where post surgery we can see, just stuck here. So I'll just share some. This patient, can you see, Rajeshri?
Yes.
Again, coming back to this patient's x-rays, and he was very worthy to, he comes with a medial osteoarthritis. Now patient understands, now seeing this x-ray, he comes with a medial osteoarthritis. And what we planned in the 3D robot about giving him a complete solution for his knee. We planned his uh, translation, we planned a partial knee, and then in the 3D, we saw what are the deformities, how much to be corrected, and then under painless and stitchless procedure, look at his both the knees are been done and look at the activities within 3 weeks. This guy couldn't do anything for the last 2 years. Forget sitting down, even going to the toilet was an issue. And see all the yoga activities which uh, the regular total knee replacement surgeries wouldn't be able to give him. And look at the activities that they can be seen after these kind of anatomical procedures. Isn't it worth these kind of procedures where people will not be able to believe what they can achieve post surgery? Cycling, working out, hours of workout, going out. And these are COVID times, Rajashri. This is not an old video. These are some new videos where patients in isolation can do all these procedures. And imagine, look at these activities,
Super amazing.
all post robotic partial knee replacements or anatomical knee replacement surgeries. And these are the activities that the patients go back and enjoy their natural activities and life. So these are possible with the partial knee, Rajashri, which really sometimes even give us goosebumps, saying how patients can really cope up with these kind of stuff, which makes us more and more inclined towards technology and these kind of procedures.
Sure. Uh, so that really brings us to the next question that, I mean, of course, the video is amazing. I mean, I was like, looking at it in complete awe that, that's the lifestyle they can really go back to. I mean, what more do we really need? Because, uh, and these treatments, therefore, they are like a blessing to us. And the fact that, you are practicing it uh, continuously, getting them for us, and then reducing the risks of a total knee replacement is just so amazing in itself. But I know that beyond that also, it's your attempt to always include even newer strategies, like including robotics, to make this even more enhanced. So if you would like to share something related to robotics, which is another thing which you always emphasize on for bringing in more accuracy, bringing in more safety when it comes to surgeries.
Uh, Robotics started as see, you need an assistant. See, like you need a GPS in the car, or you need something to guide you when you're taking a reverse car. So like if you're riding, what we say is our eyesight is one dimensional, you know, and our eyes on regular person, say 30-year-old person or a 20-year-old person, or a by birth, we have around 13 to 16 degrees of natural error in the eye. We cannot focus with both the eyes at a point which is near about 13 degrees here and there. So in, like, you have to shoot with closed eye and then shoot at a particular point. The problem in the regular total knee replacement comes when people say that I'm doing a conventional knee replacement with my bare eyes, and we have to cut the bones and a lot of stuff. But what we feel is, to get that 20-degree error cut off, we need a machine, we need some system that guides us and tells us what we are doing, and how do we go about it. So what we started initially, Rajashri, was something called as it started with one dimensional robotics. So you can see this slide. something which we started around 6 to 7 years back, was something computerized uh, navigation. We used to see in one dimension, so it was better than the regular eye for the cuts. Then we started precision alignment technology, something known as the ortholine. It started giving us 92% better planning. And then the robotics started, where we started having image based systems, where these robots, when we feed the CT scan of the patient, they give us images which are now around 98% accurate. So it is a GPS system, and it's my first assistant with me to guide where I am placing the implant, how accurate it is placed, and what are the patient's angles. See, all the idea is to place this implant in the patient's specific angle. So now you can see what we are doing about robo align is patient specific implantation. So the implant goes in your angle, it sits in your rotation, whereas the regular conventional TKR, which most of the people are doing, are put in 5-degree fixed in one plane and 3-degree fixed in the axial plane. Too much of engineering in it. But again, to place in the patient specific angle, we need this robotics. And in our 3D robotics, what we do is we feed the CT scan in the images in the robo, and it takes us to near about 42 checkpoints, and in all the three planes. So we are a three-dimensional structure, and we get a complete plan of the knee, की याचा गुडघा 20 वर्ष मागे कसा होता, and that kind of stuff. So what we do is, after this planning, we have implants and angles set in the system, which is a page 2 of the system, and where we, like PUBG, do the rotations, the placement, the movements, and before touching the patient, we have the complete idea what kind of unicondylar knee replacement is required or a bicondylar is required. So this is what robotics is all about. And once we go inside, we have these particular zigs which are planned, and these zigs help us in doing the exact surgery, exact angle of the scraping of the cartilage that is required, and that's how we do it.
Awesome. That was so detailed again, and yet so much easy for us to really understand and follow, Dr. Arbat. Well, that with that also, if you could sort of explain to us how you and your team sort of works on an integrative approach when it comes to the pre-preparation of your patients, and also post-surgically, because we are aware that you mentioned that even before when the patient actually has an online consult to actually going through to a surgery, there are a lot of interventions you have with them, of course a lot of tests, but also making them understand what they're really going through, and towards the end, of course, also after the surgery, your team does a hand holding, and you also believe that recovery should be faster and better. So what is the kind of approach you're using up there as well?
See, hi Rajeshri. So, if viewers can go into our website, I've always been a believer of teamwork. There were times when, especially in India, where most of the surgeons do single work, where they go to multiple places, operate. They are the Malak, Chalak, Sanchalak, what I call. They do everything by themselves. But see, there are now masteries in physiotherapy, there are masteries in robotics, there are masteries in, we have to have fellows to take care of the patients post-operative, and then nutritional and other stuff. So integrative approach includes, first, when the patient comes to us, we see them online or offline or in the OPDs that we have started. It is a triangle 3-point approach. So when the person sees, one of our junior consultants first see the patient, they see what are the complaints, they talk to the patient, they see what x-rays or basic inventory they have got with them. Once that is done, they give a primary idea ki madam sir, you might require this kind of stuff and where you need a special advice. See what happens is every time uh, the person not doesn't require a surgery. So there are some patients which really require only conservative therapy or something, but when I get the patient inside, I've already had the history, investigations, everything. So when the patient comes in my cabin, he's gotten by my junior staff, and then I know what exactly to talk to him. I show him. And every patient we have computer sit in front of them with patient testimonials, with the robotic planning. Everything has been shown to them. Nothing is arbitrary, nothing is been in the air and I'm talking only what we do. We show them. And this video conferencing, this uh, touch is required. Then I have a team for their personal needs, where there is some finance involved, or their patient about the money, about other stuff, even the hospital visits. So if you want to go to a particular bigger center or a smaller center where we do things, everything has been taken care by the third part of the team. And after that, my anesthesia team sees them. In anesthesia also, we are planning for stitchless and painless procedure, where the patient preoperatively is being investigated. There is nothing left to chance. All the all the things are being so pre-planned. And once the patient has been briefed of everything, he is given a date. On that day or one day prior, he gets an admission done. Then we do the procedure. After that, we have a physiotherapy team with a matrix machine. So on day one, we start mobilizing the patient. Within 48 hours, with the specialized technologies, we send the patient home. Once the patient goes home, we have online consults. So every 2 days, my team has, whether me or my team has an online consult. So patient doesn't have to come out every time in this COVID time just to show the patient, just to ask a doubt. And 24 by 7, Rajeshri, we have uh, online WhatsApp and number on our website, where you can reach us 24 by 7 for any help required. And of course, there is a nutritional part where we start your products like the flexi food, 40 food, and a lot of stuff which you can talk about in the given next 5 minutes. So that is the whole integrative approach. For the first 6 weeks, we really take care of the patient as a complete circle. So I've seen with me as a relative of my own kin, because of kidney ailment, I saw what difficulties the relatives face. And as far as possible to me, in these circumstances, in this part of the world, I have made at least 8 people are working on one patient in various fields, where I think none of very few surgeons and very few surgical teams give this integrated approach, Rajeshri. So I think that is one comes without any cost, and without any, this kindness comes without any value and any cost. So it is amulya for people who really have taken our services. They will give you a feedback how well the things are managed.
Totally true. I mean, I will of course share some of the nutrition inputs, but before that, really, going back to a couple of more important questions regarding the surgical approaches. I mean, patients do ask, should we really go ahead with a knee replacement, a partial knee replacement? So, how important it is really, to select, the proper selection, of course, of the patient and the perfect surgical treatment around it. So how do you that's where the skill really lies. And do you sort of recommend that's where patient should be going to the right surgeon,
Yeah.
who has been working on these varied techniques, so so that he can really match up what surgical treatment you would really need for the for your condition.
So that's a very nice question, Rajashri. To be honest, uh, see, now there are these techniques. Patients should understand that these techniques are done by only 10%. There's a paper which I shared with you right now, the 2020 paper. Only 10% of the surgeons in the world are trained to do this kind of robotic unicompartmental knee replacements, and whereas 90% of the lot of the individual total knee surgeons, only 10% do it. I'm not talking about the general orthopedics people who randomly do joint replacements, but in the people like us who are focusing on joint replacements, only 10% do it. So again, you have to search on uh, TRUWELLTH, Practo, and where we are all available on the Google, which surgeon can do it. Again, when somebody has advised you a total knee replacement or you're having severe pain, and you can come for a second opinion, can ask us, sir, can I do this anatomical robotic partial knee replacement? And to add to the educational part of it, who can do it? Mostly the patient with a good bone stock and
Yeah.
osteoarthritis, patients who cannot, most of the patients, around 60 to 70% of the patients can undergo the partial knee replacement, who are in the age group of 50 to 70, where they want to never do a total knee replacement, delay a total knee replacement, or in the patients who are having medial compartment osteoarthritis only, which is hampering their sports, their activities like golf, driving, sitting down cross-legged, and pain and deformity. So these are the patients who are now coming to us, ki, Doctor Sahib, I want to play golf, I want to do this, but my knee is not allowing me, and I don't want to go for a total knee replacement. So we advise a partial knee replacement. Now again, there was one dilemma that obese patients, obese females, were advised against total knee, but in them also there are papers now that we can do a total knee replacement if the bone stock is good. Which patients cannot go for partial? One is having tricompartmental, very long standing osteoarthritis, very, very bad osteoarthritis, and that is not a rocket science, which people understand what I'm talking about. Second is people having some inherent diseases like rheumatism, they have ligamentous issues, untreated ACL, PCL, where don't have the natural anatomy. ज्या पेशंटची नॅचरल अनाटमीच खराब आहे, त्याचं खूप lot of years they have never had an ACL done or something like that. Those patients we cannot. And the patients having kidney ailments, some inherent infections, HIV or other that kind of stuff, where uh, the bone stock is really very bad. Otherwise, most of the patients who come to us early, so it's like an angioplasty, Rajeshri.
Yes.
So patients with the same doctor, he can undergo angioplasty. With the same doctor, he can go and open heart surgery. So people who reach us to the right time,
Yeah.
they can really undergo this. And the survival index for this now is more than 35 years on paper, like I showed you. An excellent 10 to 15 years of survival with 96% satisfaction, which is a very high satisfaction compared to 70% satisfaction of the TCAR. But you have to reach those 10% people who do it. So in our country, technically, when it is America saying 10%, here the 2% of the surgeons do it. So they have to reach the right surgeon. What happens is if they reach the wrong surgeon, he doesn't give an option only of unicompartmental, because over these years he has never been doing that. But that doesn't mean it doesn't exist.
Yeah.
So if you talk about asteroid belt, nobody talks about them. Doesn't mean it doesn't exist. It exists. You need to have a Hubble telescope. So our Hubble telescope is our Google. You search for people like us. You can have a second opinion. We can have second opinion online also. And if need be, pan world, we are getting patients from Birmingham to Nigeria to Oman to India to Calcutta to a lot of North India, and of course our Western India region. And people are really approaching us for these kind of stuff.
That's really amazing to know,
And
Dr. Albert.
thanks to your platform also, that you are reaching pan world, and we are very proud of your
Yeah.
platform also.
Well, almost all of our programs are now reaching more than 8 to 10,000 people, and I think it is a continuous and relentless effort that we have been taking, being here every Friday with a new topic, new techniques, and the pros and cons, and so many insights on each of them. And thanks for you to spend so much of time in putting all of those slides together, all of those different testimonials together, so that we can actually see the effect on the patients. Um, you did cover so much in detail as to how we should go about how do we understand how does the doctor really actually choose the right technique for the patients, and so much care is really taken, and this technique which you really talking to us today is going to be so much beneficial. You actually even showed us the evidence that the possibility of failures, the possibility of more complications, better mobility is definitely achievable with this technique. I'm sure I will have a few more questions, but before that, I'll just quickly showcase a few inputs about nutrition. As you did mention. So I'm going to pull up some of the slides, and while I am doing that, I think a couple of questions, did coming from the patients, of course, is something we would take up with you, because people do have questions about still they worry about the complications, etc. But here are a few slides I am going to share with you all. And what's first and foremost that is important is not only what we do post surgically, but a lot needs to be done pre surgically. And nutritional status actually plays a very important role as to how much easier you're going to recover from your condition, from your surgery, and also especially in cases of partial knee replacement, where you're still going to be a candidate for knee issues. In especially in these kind of patients, it's extremely important that we have a balanced plate, a balanced nutrition. We eat good amount of vegetables, fruits, along with good amount of protein. And we have to understand that when it comes to macronutrients, our balance, especially we in Indians, it's like our protein 25-35% is also much higher. People do not even have that much of proteins, is what we have observed at times. It's most of carbs and fat that we are consuming. So we really need to move from this leftmost circle to the rightmost circle, where more and more protein needs to be consumed, especially in cases where we are suffering from these kind of conditions, and also when we are recovering from the surgery. This is actually the best approach, to hike the proteins in your diet. Also, say around 30% of fat is good enough, and reduce the number of carbs that you are eating. Also, when we are choosing the proteins, and which is why we at times land up also giving supplements, because wherever there is shortage, supplementation is essential. So don't shy away from it. But otherwise, even foods, we have to make sure that we eat variety of fruits, vegetables, and so many different dairy items, which I'm showcasing here. If you're non-vegetarians, you're more luckier, because you can actually consume chicken, fish, nuts, again, beans. All of these are extremely important when it comes to having a good protein diet. And it's very essential, going back to this slide, really, that there are amino acids like glutamine and arginine, which are extremely important for the recovery from the surgery. It's very beneficial for our muscles and bones, and isoleucine, leucine, valine. These are the ones which actually create the mesh in our bones, on which all these minerals and vitamins are going to sit. So very important that proteins are consumed. Also with it, we need to correct the vitamin mineral deficiencies. We do not thoughtfully eat, and which is why deficiencies are normally there. So early on, even before the surgery start, you're going to surgery a month before that, or whenever you're going to plan your date, way before that, we should start supplementing with good amount of proteins and vitamin minerals. It's extremely essential, because it will help in the success and success of the surgeries, and in a better outcome, and also recovery. So that's important. So I keep emphasizing that, like I said, everything needs to be present and taken together: proteins, vitamins, minerals, and antioxidants as well. And while we spoke about proteins, why? Because proteins really break down in those amino acids and also give us energy and muscle. These are the two things which are very important after an outcome. But what we're observing here is there's something which is called enzymes. Now, enzymes are catalysts in our body which really help in digesting whatever we're going to eat. So, it is important that we should eat all types of enzymes when it comes to it, because what happens is if you eat enough amount of proteins but if they're not digested well, and a lot of us, because we don't eat proteins, have we are not able, our intestines, our stomach is not able to digest these proteins well. So it is essential to take such enzymes, and also to digest fats and carbohydrates and fiber altogether is extremely important. Also, it is important for the uptake of vitamin minerals. So enzymes are something which we need to watch in our foods, and that's exactly what we do in our diets that we give you. Apart from that, of course, we have something that we extremely need to understand is that oxidative stress and chronic inflammation. These are the two things which are intrinsically present in people who are needing the joint replacements, because of course we may be obese or we are doing too much of activity which is aberrating our knees, but if it happens early on in the age, there is definitely chronic inflammation in the body, and it's extremely dangerous. This is what it does to our cells, and it's going to eat up its own cells, and that's what is happening, especially with our knee cartilage. While it does to several different organs, we have to realize that our joints majorly get affected by it. There are several different ingredients which can help protect our knees, especially when we have gone through a partial knee replacement. We are definitely going to be a candidate, maybe to avoid being a candidate for a total knee replacement. We can definitely avoid it, and if to avoid it, such anti-inflammatory supplements are extremely critical, which include Google. There are two types of Googles which come from India but are avidly researched all over the world. And those two are Boswellia serrata and Commiphora mucor. So many studies are available out there showing that they are so effective. They've shown so much effect in reducing pain, stiffness, and bringing back mobility. So and reducing the inflammation, pain, big time. So that, along with glucosamine, curcumin, ginger, these are very effective ingredients along with MSM. That is what from my side I would really want to advise to most of you here. And I'm going to quickly also share when it comes to the products. Aashish Arbat, Dr. Aashish Arbat did mention that these are the ones he did mention a couple of products. I just want to quickly showcase them, but again, these are given with a lot of caution, studying each of the patients by him and by us. And Energia Flexi Food, which he mentioned, it really has the widest anti-inflammatory action to protect our joints further. So it does contain all these ingredients which I mentioned to you, the types of guggul's. It has ashwagandha in it. It has ginger, turmeric, along with the modern research ingredients which include collagen, glucosamine, MSM, vitamin C, big time, and it's a vitamin which really helps scavenge further damage to your joints. So you should go for such kind of synergistic formulas like Energia Flexi Food, which can actually help you protect your joints further down. And like I mentioned, proteins, vitamins, minerals need to be going together, and the proteins have to be giving you the right amino acids that are needed for your recovery. So it's These are the couple of inputs I wanted to share again with you all from a nutrition perspective. But going back to you, Dr. Arbat, a few questions that have come up is one of them, of course, is related to complications, which most patients always worry. So, they hear a lot of things, and I think stiffness and pain is one of the most important things they understand, and they are troubled with. So question comes that will these partial knee replacements increase pain or stiffness because it's partial?
It is exactly the other way. uh, the question would answer is exactly other way, because in this technique the stiffness doesn't come with the surgery. There are two things that give rise to stiffness: is if the surgeon has cut a lot of muscles there, it has tackled a lot of bones, and he has taken too much of time. I've seen people doing hours and hours of surgery where we finish average surgery in 26 minutes. So stiffness can be because of impending infection in a very very small center, if with a newcomer doing experimental surgery. Secondly, in a government setup where the infective conditions are not being very very well tackled, some of them. And third thing, the stiffness is because of two things: is a big cut, and here exactly the reverse happens. Patients don't get stiffness because the muscles are not being involved, so the soft tissue damage is very very less. This is one of the reasons that why we do this partial. तर ज्यांना स्टिफनेस नको पाहिजे तर त्यांनी हे anatomical. So we are doing this like a partial knee replacement is like a plastic surgery. We are not cutting the muscles, there are no stitches inside. So that is the whole idea. And third thing that Rajashree said is, even if everything goes right, if you are a diabetic, if you are bad in protein intake, if you are bad in, though that is a 2 to 3% of people who experience some stiffness, and where our team makes it specific to have those nutritional products, and then the stiffness is totally been overcome. So nutritional stiffness can be totally overcome within couple of weeks, but and there is no surgical stiffness when we are involved. Only thing, if you get the surgery in the wrong hands, the wrong technique, and the wrong implant, the wrong surgeon, you will get stiffness, and that is been very very candid and open about it.
Great. I think that's really the one anxiety. And of course, the other question was related to infection, which we already addressed. So I guess,
To
I
begin
think,
with, Rajashri, infection 90% of times is related to the surgical thing. The last near about 850 patients in the last 2 years, near about we do
mhm,
400 to 500 knees per year. We
mhm,
had 3 delayed infections 8 months post surgery. All of these 3 patients in 800 patients, we statistically are very small, came to us after 8 9 months. One of them had a skin issue of psoriasis, and he had taken
okay.
steroid treatment, but now we did a revision, she's happy, they reached out on time. Second was a rheumatoid patient who fell down, did a dressing at
Hmm.
his home, and there was a cotton stuck inside, but zero
Yeah.
infection from our operation theaters, from our technique. But the operation theaters are very very well equipped, and our speed of the surgery is tremendously fast. And
Yeah.
we have been working very very hard, Rajesh, over these years to be
Yes.
upfront coming and talking on this kind of stuff, that yes, uh, we are tremendously fast. It's like MS Dhoni or
Yeah.
Yuvraj or that kind of, yes, we have hit six sixes multiple times, and we are having zero infection rate in compared to the surgical technique. So infection is one thing you really have to be afraid about, and that is the reason why you should choose fast surgeons, trained surgeons, and extremely good operation theaters where even these surgeons operate. So they should choose their surgeon. It's a surgical problem. So you should choose your surgeon. I mean, very, very, very specific on that.
Yes, and I think that's something which yeah, our viewers are definitely understanding from all the different aspects as to uh, right from which type of surgeries, when to come to you, what are the outcomes. I mean, they've seen that through, and from that, they've definitely understood, what is the criteria for the surgery, and who are the surgeons, of course, they should be visiting to understand all of this. And again, you also mentioned that if they need any sort of second opinions, they shouldn't really shy away from approaching you and your team. And it's really nice to know that you have such a great team approach, and you handle the patients right from the beginning to the end. Just as even I was mentioning that from the beginning itself, they need to be given good amount of nutrition, and you make sure all that is done and they're comfortable, and yeah, you're planning their surgeries well. You showed the video of the patient. These are COVID times, and even then, you're taking so many precautions so that the patients are safe. You had mentioned that your teams also get tested so that everything can be safe for everyone. So that's these are all.
To add to that, Rajashri, patients should understand that who are the people who told them about COVID? We have told them.
Yeah.
The super specialists have told them. Whatever the humbug in the media and all is started after we doctors told you, we know how to handle it. This is not the first infection that people are really not understanding that the major problem of this country over from independence has been tuberculosis. Who has handled it? We have handled it.
Yeah.
So this is a virus, this is fine. But when the centers are right, the doctors are right, you need not have any worries that there are COVID times. So you traveling back. These particular centers that we work in are not going to go you COVID because they're totally, literally cleaned every third hour. There are not a single staff that is COVID positive present. And if there are symptoms, they are sent home. We know how to handle it. We know how cleanliness, because these we are the people who start. It starts with us. Please understand. You're not going to a sabzi market where you're going to get some COVID or something. Yes, there are some random hospitals which might give you, and we are not at that random places. We are very selective where we work. We have cut off our OPDs where even there is COVID admissions. So we are doing OPDs in particular brands where in that particular center, COVID is not present at all. Third thing, we have to understand that this is a new normal. Sitting for it to go and then, one fine day, the Prince Charming will come. It will never be happening. We have to understand that this is a new normal, and our diseases are also very important. Our heart ailments, our knee ailments are very, very important. And those who cannot reach us just for the OPDs, our online consultations are there. So they can completely have 1 or 2 or 3 sessions with us online. They can take a call. We can even arrange a COVID free vehicles for them so that they don't get exposed to the environment. And once they come in the hospital environment, the centers that I work in are totally COVID free. There is no exposure. They are more safe because it's a thing that has been cleaned every 3 hourly. It is like an operation. The whole hospital is like an operation theater. It's cleaned and cleaned and cleaned. So you are more safer than your house in the hospital.
Great. I mean, that's really so much of caution and safety that you are taking, because that's worrisome for all of us really right now. And what you said is absolutely right, that we can't be waiting for any sort of miracle to happen, that this COVID is just going to go away. It's going to be with us, and we have to start living with it, especially when we have elders in the houses who are not going to be feeling good about all these things. All of that has to be addressed. At the same time, even the working class, the population is who's between 40 and 50 age group. They also are facing so many of these pain issues, and they should be taking advice on it instead of just sitting at home and not doing anything about it. Because we are almost now a year down into this, and if all these keeps piling, it's just going to aggravate all the issues that we have, and we won't be able to prevent anything.
And we
So
won't be able to get these modern techniques.
yeah.
Yes, there are cities and there are places, crowded places like Mumbai, and where things are really. Yesterday, I saw the train situation and all that. Yes, people have to take care of those kind of situations. But now it is very imperative that you should be afraid of a local train and crowding 200 people in the compartment, and then I don't understand, and then to come in a completely COVID free environment and COVID free hospital where you're going to be treated, you're going to be benefited. So yes, you should be preventing the old people from going to these markets and local trains and all that. But these hospitals like Jehangir, Sahyadri, where I work, especially our OPDs in Jehangir, are totally COVID free. I am again repeating, you are more safer there than your society.
Good. So we're very glad that you have been with us through all these difficult times. Though through them we have relentlessly been here for the viewers, and of course I can't but thank the viewers for always being with us, trying to watch through our programs, gain as much. They can from these sessions, because that's really the idea of True Wealth, to get you as much authentic information, as much latest techniques that we can, and that's really gets achieved with this bone muscle joints series with you, Dr. Aashish Arbat. And thank you again for always being with us. Next Friday, of course, we are planning to come with a fitness program, because we are True Wealth is extensively supporting the Fit India movement that's happening, and really fitness is so much important. Prime Minister Modi yesterday held this more than an hour session with so many of the fitness and nutrition specialists, and doing a program with you, who's an orthopedic specialist, who really deals with the bone, muscle, and joints. Will actually be a great thing, and we thank you for supporting us in that, and being ready to actually do a session on that with us next Friday. And viewers, we are actually going to start with our sessions from tomorrow, supporting the Fit India movement. I'm of course going to do a session with Meenakshi Sabko hosting it, and we are going to talk about nutrition and the power of nutrition and fitness. But Dr. Aashish Arbat, hope you get some time to see our session. But we are really looking forward to next Friday again with you, and I'm sure it's going to be a very interesting session. We both will plan up for the viewers. So looking forward to it, and thanks again for being here. If you
Thank
would
you.
like to say a few words and close the session, we can do that.
So always it was my privilege to talk with Rajashri here and the viewers. So there will be a lot of platforms that people listen. Choose the right doctor, choose the right place, and choose the right time. So you can be really benefited. You are what you make. Choices maketh a man. So you choose right, you will be having a good life. Thank you, Rajashri.
Thank you. And to add to it, choose the right platform for getting your education.
Yeah.
Well, that's saying bye from the Bone, Muscle, and Joint series for this week, and we'll see you again with the series next Friday. I'm going to leave you with a small promo from our support that comes from RSG, Energy and Nutrition in Healthcare. They do support us through all the different flyers, sending out information about the educational programs, very much selflessly, and also supporting us technically with Ms. Mahesh Darade's guidance, who leads them in actually putting all these on 6 different channels, so that maximum number of people can actually watch this program.